I'm Dr. J.C. Smith again. Today I'm speaking with my patient, Jimmy Banks, former Air Force officer, great athlete, and he also has a terrible bad back. As good as he looks on the outside, on the inside he's a mess, as you can see here. And he came to see me a few months ago.
Yes, sir.
Right?
In November.
November?
Yes.
And tell him your story, what you were told by the previous doctors.
Well, what initially started off with, I had sciatica, bad back. He told me I had degenerative disc, excuse me.
Yeah, degenerative disc.
Disc disease.
Right,
I had lumbar stenosis or something like that.
yeah, the narrowing, yeah.
Correct.
Yeah.
And they said, well, we can fix this thing for you. I was like, okay, how? So we could go in there and do some back surgery and put these stable links or put things into you like that and get you fixed like that. And I was like, and by the way, we're gonna do a fusion on your L2, 3, 4, and 5. I was like,
L2, 3, and 4, and 5?
2 to the 3, 3 to the 4, something like that.
4 levels of fusion.
Yes.
Yeah.
I was like, that doesn't sound good to me. I was like, so let me think about this and I'll give you a call back. So I want to do some more research on this. And so after I did more research, I realized that is something I did not want them cutting in my back, putting things in, and fusing, they're telling me they're solidifying something.
Yes.
It's like, no, I don't want that. Let me find another avenue. So I saw a commercial about somebody say, hey, we do a small incision and do the same fix.
The minimally invasive surgery.
Minimally, still invasive.
Yes, right.
The key word, invasive. And I said, no, I don't want that neither. So I went to a couple of chiropractors and physical therapy, and that kind of got me going. And the problem still existed. And I just happened to be riding down the street one day. I saw this sign that says, DRX9000. You can get your back fixed without surgery. It's like, that's the place I want to go to. And so I stopped after I read the sign, and it's like, I got to go in and talk to this doctor to find out what's going on or how good this thing's supposed to be. And after my first conversation with you, I thought this is going to be something that will work for me. And when I tried it, I'm here now. There's no surgeries. I have no pain going down my leg. Not taking pain pills like I was taking. So I'm walking all right. So
congratulations.
Well, thank you.
Yes.
So
So
even
what's
with
your
a bad back and all.
I know. And the thing is that this is what research is finding, is that even though you have bad disc, look at the bone spurs there.
Yes.
Up here it's all twisted.
Spurs.
But the fact is that if we were to take an x-ray today, you'd probably be identical. But your pain's gone, because most back pain is not due to the disc and the spurs and all that. It's due to how the spine function.
Yes.
And that gets back to the 4 principles we teach you. Do you remember them?
Yes, sir. I think it's adjustments, strengthening, and compression.
And flexibility.
Flexibility.
Yeah, joints are supposed to move, right?
Okay.
But what was interesting, when the first time I adjusted Jimmy, I actually adjusted the sacroiliac joints, these side joints. That's when your pain subsided, right?
Yes.
We're still doing decompression to try to rehabilitate these squished discs that are in there. But even still, when you're feeling much better, you're still going to have that pathoanatomy. This is the big debate now, is it pathoanatomy, stenosis, bone spurs, bad disc, or pathophysiology, how the spine functions. And that gets back to the 4 principles: alignment, strength, flexibility, decompression. And if you work on those, even though you still have that garbage in there, you're going to feel and work a lot better. Okay. But this is what the MDs aren't telling people. This is what the new guidelines say to do first, is conservative, non-drug, non-surgical care. But they just want to railroad you into those surgeries. As I've learned, MDs do not follow guidelines, they follow the money. And the money in spine care is outrageous. The Mayo Clinic says 1 level surgery, $77,000. So he wanted to do 4 certain level?
4.
Yeah. There's a surgeon in Centerville who I have patients where he's fused their whole necks.
Yes.
$250,000. And I've had 3 of them come to my little clinic. God only knows what the other people are doing, but this is a big ripoff. It's the biggest scam in medicine, is all these back surgeries they're doing. That's not to say that there's not a need. They call them the red flags. Cancers, fractures, infections, cauda equina, loss of bladder control. But that's only 10-15% at the most. 80-85% of people with back problems have what you and I have, mechanical problems mostly.
Right.
Even though, according to the Mayo Clinic, by the time you're 50 years old, there's an 80% chance you're going to have disc degeneration, but you won't have any pain. We have a chart of that and a brochure that I give to people because, again, that old folklore that bad disc causes pain, means you need surgery is untrue. That was first disproven in 1990. And since then, there's been 32 other studies around the world that say the same thing.
Right.
So the Mayo Clinic in 2014 did this systematic review of all of those and came up with this chart that we'll put on the screen and show people. Just because you have bad disc or stenosis or bone spur, it doesn't mean you need surgery. And it may not even be the cause of your problem. Like say with you, I adjusted the sacroiliac joints, because that's a big, and there's not even a disc there.
Right.
It's just where the bone butts up against the bone. It just slips 2 millimeter. That's a big pain in the butt. And I know I've had it myself. That's why I tell people, before you do surgery, come talk to us. Bring your MRIs, your x-rays, and learn how to really manage a back. It's not by having more drug shots and surgeries. Unfortunately, that's what they do, and that's why back surgeries have a huge failure rate. And the opioid epidemic is due principally to back pain. There's legitimate uses for opioid pain pills, which, by the way, most people don't know are actually medicinal heroin. Did you know that?
From talking with, I did not know that until our conversations.
I know it. They don't tell people. They say opioids. People know what that means, or they do the brand names. Oxycontin, hydrocodone, tramadol. That's heroin-based pain pills. There was a study done at the VA in Minneapolis, and they found that those heroin-laced pain pills were no more effective than taking 2 ibuprofen. It's just they get you high. And that's what people high, and that's what gets them addicted. So like I say, the only legitimate reasons for those is post-surgical, cancer, terminally ill. But most are taken for musculoskeletal. Number 1 being low back pain. A third of them are low back pain alone. That's why there was a study done in the VA by the RAND Corporation, and they found for vets who had back pain, who had chiropractic care, 59% of them were able to get off the opioids.
Wow.
Another study showed 57% got off it. Yet the base is still handing out opioids like candy. They're not referring to chiropractors. They're putting active duty people, TRICARE patients, and workman's comp people at risk by following the old outdated models of care, drugs, shots, and surgeries. And they don't give informed consent, telling people you can see a chiropractor, which is illegal, but that's what they're doing. So that's why we want to have people come in like you, who've been through the route, whether it's former chiropractic care, medical care, PT, physical therapist. Come in, talk to us, and there's a good chance that you can avoid this.
You said a couple things on here about you're having a back problem, but not the pain, and that was my case. My back been from a military, time frame. I've had that back problem for a while, but I didn't have the pain. And as you said, you can have that without the pain, and that was my case until something happened where something addressed, right?
And that's an old injury. You probably got that when you were playing ball back in high school.
Probably so.
And all that.
And then another thing I was taking shots in the SI joint. Extremely painful. I was like, there has to be another way. So that was another reason I was like, I hope he has a fix-all for all this thing. And so far, that DRX9000
That's amazing, isn't it?
It is absolutely amazing.
And it's so simple, but speaking of epidural steroid injections, the research on them deemed them short-term at best, very expensive. If they shoot it in the neck, it can cause blindness or strokes. One researcher point blank said they're underwhelming. They're charging as much for one epidural shot as I charge for the whole DRX program. That's
amazing.
amazing.
It's amazing.
Just medical spinal care is out of control. They're making, it's $100 billion a year industry now.
Wow.
That's how, it's crazy. But that's what they do, because that's what they do. And that's why I'm happy you got good results. And there's other studies that say basically what you experienced. Mm-hmm. There was a study done up at Brown University, the Ivy League school in Rhode Island. Mm-hmm. And a colleague of mine, Dr. Don Murphy, is doing that one. It's where they had people with stenosis, mm-hmm. which is where the internal canal starts to shrink, or you get occlusions, right? And most people have that too. Yeah. But he did exactly what we do here. He didn't have the DRX, he had the lesser chambers like we have across the room, that flexion distraction, and he did deep tissue massage. And they got a 75% success rate with those patients.
Right.
That's incredible, 75%.
That's a huge.
And so I wrote Don a note, and I said, Don, congratulations. I said, but let me ask you a question. Even those people are feeling better, they still have stenosis, right? And he says, yes. He goes, bingo, yes. And that's the same thing. Even though you're feeling better, you still have the bone spurs.
Right.
So again, it's not pathoanatomy, it's pathophysiology. How does the spine work? And that's what we work with patients. Like, luckily, you're strong and already into accomplishing the strength. Now you got to work on flexibility,
that's good.
Continue decompression, get your adjustments, and maintain a good diet, anti-inflammatory diet, and that helps immensely too.
And another thing I like, you not only tell me about, all right, here's the things we're going to do for you, but it's also an educational thing. You say, here's some spine exercises to strengthen your spine. And that we didn't have before from anybody.
Is that right?
No, they just give you a treatment and see you the next appointed time. But the educational part is key as well. So here's things to strengthen your spine. You do these things here that will help you out along the way. Don't just depend on an office visit. Do your homework as well. So that has helped me.
Yeah, great. I know. I've heard that from other patients, and to me, it's like going to a dentist who doesn't teach about toothpaste. Yeah. You're bound to have future problems.
Correct.
Because my goal is not just get you out of pain or control it, and usually in 2 to 4 weeks, you're 50 to 99% better. But long-term management. And I've hurt my back seriously 3 times, playing college football, getting thrown off a horse where I came down and landed on my head. That was no fun. Yeah. And then starting a lawnmower, I pulled the cord and threw my sacroiliac out. So I've had 3 serious injuries that I've had to learn to manage myself. Mm-hmm. That's why I'm adamant. If you want to stabilize this, you got to do your homework.
Got to do your homework.
But some people don't. They want the quick fix, as if it's pulling a thorn out of a paw. Right. Well, that doesn't happen with back injury. Even though people like you might get temporary good results, if you don't go ahead to the next step and stabilize it, again, you can just sneeze, throw it out, and you're back to square one. It's hard for people to learn that an ounce of prevention is worth a pound of cure. Right. It really is.
And it doesn't. I also purchased a inversion table. Some people say, that costs too much, but they spend thousands of dollars on other things. Yeah. That's temporarily. But to buy an inversion table or something that's going to help you out, hey, what's $300 versus you spending money on your health?
I know, that's the thing. People don't invest in their health. They invest in sickness care.
Correct.
But they won't invest in true health care.
That is right.
The ounces of prevention. That's right. That's why I tell people, your habits catch up to you.
They will.
Whether you're smoking or eating junk food or sitting on your butt, never exercising, they're going to catch up to you. And then you're going to wonder, I'm 50 years old. Why do I have hypertension and cancer and diabetes and obesity? Well, golly gee, for 50 years you've been doing nothing healthy.
That's right.
And you wonder why. And I say your habits catch up to you, but we don't have a health-oriented society. 10% do, like yourself, but 90%, they're 50 pounds overweight. They live on junk food. And I suggest maybe you should stop eating pizza every day. They look at me like I'm nuts. Maybe you should walk around the block. What? You want me to walk? It's amazing the excuses I hear, but when I was growing up, my mother was into nutrition heavily. Then I went to the chiropractic college, and they taught all natural health care. And so I learned that health care is having healthy habits. Today, no, that's too much trouble. Today, health care is taking more meds, having more surgeries. Yeah. You know that the New York Times did a study on drug ads on TV? They're incessant, aren't they? This was in 2017. They found that there were 900,000 drug ads on television. That's 3,000 a day. Wow. And we wonder why people are drug-oriented. And are they any better? No, we have the worst health statistics of all the industrialized nations in the world. But we spend twice as much. It's amazing. It just isn't working, but they're in control. And that's why I say, if you want to be healthy, you got to be radical.
Right.
You got to think outside the box.
You have to. They say
But-
we're the richest country there is, but the poorest in health.
Oh, it's horrible, isn't it? And we have the richest medical profession. You know, the United Kingdom, we do 5 times more back surgeries in the United Kingdom. Why is it? Do we have 5 times weaker backs? No, we have 5 times more surgeons.
That's it.
That's the problem. Well, anyway, it's good talking to you again.
Well, likewise, sir.
Hopefully encourage people to come on in and have the same good experience that you've had.
Most definitely.
Right.
I encourage you.
Good. Hope you learned something. We're signing off. Thank you.